Good afternoon and welcome. My name is Dr. Darrell Hill and welcome to Doctors in the House. This is our first episode and we are glad to be here with you today. I'm going to give my guest, Dr. Rick Bryson, a chance to introduce himself.
Yes, hello Darrell and good evening audience. My name is Dr. Rick Bryson, a podiatrist here in Prince George's County, DMV area.
Mm-hmm. So we're here today really to kick it off. We got our new show happening, Doctors in the House, and this show is really about you. It's about talking about health issues, about bringing education to you, about bringing doctors to you, and about giving you a chance to ask questions of us and learn so that we can help improve everyone's health out there. So Dr. Bryson, tell me, what are you noticing these days when it comes to people's health? Are things moving in the right direction?
Well, you know, there's a challenge with health in this country and specifically in the African American community. We know that the indices of that indicate bad health, chronic disease, black folk tend to be at the top of the unfortunately leading in those negative indices. We have a situation where recently from the last federal administration with the Health Care Act, it allows some people to gain more access to health care. However, there's still some issues with the quality of that care, how care to a certain extent is being rationed. And I think in general, people are making a more concerted effort to be aware of their health and things that they can do to take advantage of opportunities such as information from shows like this. Internet provides other resources where I always encourage patients, anyone that I deal with, to be proactive with your health.
Right. You know, and today, with this being our first show, I'm hoping we can just kind of talk a little bit. We're going to share with the audience things that we're going to be doing over the course of the months to come when it comes to health issues. You know, we're gonna have fun. We're going to talk about education. We're going to be bringing different doctors in here, the dermatologist, the surgeon, the gastroenterologist. We're going to be talking about what are those tests which can help make someone be a little healthier, be around a little bit longer. And like you said, you know, health is so complicated these days. We're going to talk about some of the government policies. We're going to talk about a lot of what's happening with our demographics, our senior care population. Because, you know, I'm going to give you a chance to talk more about the things you're doing and the things I'm doing. But, you know, right now you're focusing quite a bit on our senior population.
Yes, I have a special love for our seniors. I think in our community, seniors are revered. And unfortunately, some of the things I'm seeing is that due to the fact that in part because of health neglect over the years, there are complications that have arisen, specifically with what I deal with, lower extremity problems.
Right.
And you have very simple things that I've seen become very detrimental. Anything from a simple ingrown toenail that's not treated correctly can result in infection, which can lead to gangrene, which can lead to amputation, which can possibly lead to death because statistically speaking, those who have an amputation, their life expectancy is decreased.
Right. And that's interesting you say that, too, because it's incredible, I think, how much experience you've had, and myself, too. And I think it's incredible when you have a chance to share that with our audience. And by doing that, we all are better off as a community and as an individual, too.
Yes, the village.
Absolutely. So, but like I said, we'll be bringing in a lot of different people to help our audience learn more about their health. You know, we just got over this whole Obama health issue and what that meant and how it affected so many people out there. And, you know, I was surprised to hear, even with the government shutdown most recently, I never thought about it, but people were losing their insurance. You know, we're talking about diabetics who couldn't get their insulin. So we're talking about some major issues here.
Yes, and specifically with the access to medication. Obviously, dealing with our senior population, and most seniors use Medicare as their primary insurance with the Medicare Part D, and also with even with the mail delivery, I happened to be in the post office the other day, and a gentleman was there simply because the mail was not being delivered to his house. Part of it was logistic things. I don't know if he had just moved in or not. But he made the comment that he was really concerned because evidently there was some person in that household who needed medicine. And with the medicine being delivered by mail order, if there was an issue with the simple delivery of mail, that meant there was a breakdown in terms of that patient having their medication, and therefore obviously many things can happen from that.
Yeah, I've been amazed with a simple transition like you're saying now, with all of the emphasis on getting medicines out through the mail, what that means now, how long, 2 or 3 days, up to a week, someone walks into your office now. They just can't walk to a local pharmacy in some cases to pick up the medication. So all of these things are having significant impacts on the day-to-day activities of our patients. And you know, with hospitals, even here in the county, you know, we got at least one new hospital coming, and we had Laurel Hospital closed down, and we want to talk too about what that impact is doing to our local communities. So we're going to have a lot to talk about, and we'll be looking forward as we move on to hearing from our audience on issues that they also find needed to hear more about. Assisted living facilities, nursing homes, that's a whole new industry. I don't think many people know that in our ordinary neighborhoods, all these facilities are popping up.
Yes. And as a matter of fact, in my practice, a large part of my practice deals with visiting those facilities to provide care. And one of the things that I do realize is that, as they say, if you live long enough, you're going to need at some point someone to care for you. I guess we talk as a younger person. I know I often was approached by insurance individuals about purchasing long-term care insurance. I think traditionally in our community, when a person ages, if the family structure is such that they can support them, oftentimes it became a thing that mother, dad, grandma, granddad would come to live with one of the siblings. Now, obviously, as the demographics have changed, folk aren't having as many children as before. So those options are becoming limited compared to what they were 15, 20 years ago.
And that's why I'm so excited about this show, because we're going to talk about bringing that financial guy in here to help us understand more about what that really means. Because think about it, not too many people can pay for that long-term care insurance, and people are living longer, and we don't think about these things until it's too late. So I'm excited. I'm glad you're here. And I'm glad we have our audience out there. And I think as we move forward, we're going to continue to make our communities healthier. So as we move along, why don't we just stop right now and just give you a chance to tell us who you are. Tell us what you do. Tell us about your education, your background. And I'll be curious to hear, too, about why you chose your specialty, because the reality is it takes a special person to provide health and care to other people.
Yes. Well, again, my name is Dr. Rick Bryson, practicing foot care, lower extremity care. And one of the things that's so important, that what I've seen when I was in college, I actually played a little basketball, and I actually had a lot of foot ankle problems. And when I was deciding on a career, I knew I was on that healthcare track. And what led me to specifically want to pursue podiatry is that podiatry offered a lot of sports medicine. It was one of the specialties that sports medicine was actually an intricate part of the profession. And that's what sort of led me to podiatry. And again, the other thing that actually I think caused me to want to pursue podiatry is that I remember as a youngster taking my mom and grandmother to the podiatrist. And I often, because of injuries that I suffered, I went to a podiatrist. So I was aware of what podiatry was. And I don't think you enter undergrad saying that you want to be a podiatrist. But nonetheless, it is a profession I chose, and I've been I feel very fortunate to have developed a practice where I feel that I am definitely making a difference. I mean, you
Right.
hear it every day, and you can see it. Now, part of one of the situations that I often see, as I said before, is individuals who, due to a large extent, neglect of not having foot care.
Right.
The complications. I think we all know about the relationship with diabetes as it relates
Okay,
to
we
foot
got a lot
care.
to talk about when it comes to diabetes.
Yeah, that's
Quite
a
bit.
biggie. That's
Quite
a biggie.
bit.
That's a biggie. But that's not the only condition. But as it to piggyback on what you alluded to with insurances will make a big deal with the condition of diabetes for foot care. However, that is not the only diagnosis that usually leads to detrimental problems with your foot. Anything that circulatory problems
Right.
from various reasons.
Absolutely.
Yep.
Absolutely.
And also, as I said before, there have been a number of seniors that I've seen who've developed something as simple as a hammer toe.
Oh, yeah.
A hammer toe.
I got a few stories I got to tell you about as we get a little bit more into this when it comes to some of these simple things that turn into major things because people just didn't know.
Exactly.
So before I forget to mention, the call-in line will be 240-719-2560. This will be a call-in show. We will take calls. We appreciate all the calls. I know we have a caller on the line right now, and so why don't we go ahead and take the call? Hello, caller.
Hey, Doc.
Hello, caller.
Doc,
Hello?
Doc, can you hear me?
Yes.
How you doing today?
Doing great. How are you?
Man, I'm great, man. I've been seeing you for a while now, man. It's Gaskins. How you doing, brother?
Good, good. Who's this?
Mr. Gaskins, the owner of the station.
Hey, what's up? How you feeling, man?
I'm feeling good, man. Y'all in there looking good. Y'all talking some y'all dropping some knowledge on folks, man. That's good, man. I like to hear that, bro.
That's what we're here for. We appreciate that.
For sure, man. I just want to congratulate you on your new show, man. I'm so glad you joined the team. And tell everybody where you're located and everything, man, how to get a hold of you and everything, yeah.
Absolutely. My office is located in Laurel, Maryland, 13635 Baltimore Avenue. That's 301-497-0401, 301-497-0401. Also, we are always open 24 hours a day on the web, www.laurelmedicine.com, www.laurelmedicine.com. And I'll give brother Dr. Bryson a chance to introduce his information.
Yes. As I said before, currently I service the DMV area. The easiest way to reach me is via telephone, 301-706-6437.
Okay, Dr. Bryson, what do you specialize in?
Podiatry, sir. Foot and ankle care.
Foot and ankle care. Okay, circulatory things and this and that. You take care of that.
Right.
Yes, sir. Yes, sir.
Okay, man. Okay. Well, Doc, like I said, I tune in and watch you gentlemen. I just want to call in and congratulations to the team, man. God bless you, man. Hope you do well, brother.
Thank you. Appreciate you.
All right, y'all have a good day, man. I'll talk back with you, bro.
Thank you. So we were talking with Dr. Bryson. He was just kind of sharing with us some of the things he does, and we appreciate that. I'm going to take a moment now just to kind of tell you about myself. So my name is Dr. Darrell Hill. I'm originally from New Jersey. I attended Rutgers University along with their medical school as well. And I'm an internist, so after medical school, I did a residency at the University of Maryland Hospital. Had a really good time, worked hard, learned a lot, and since that time, I've been in private practice in Laurel, Maryland. And in my practice, it's a little different. We do our best to develop good relationships, which are long-lasting relationships, and we manage all the usual stuff: your diabetes, your blood pressure, your heart disease, and we do a few unique things in my office too. We've been one of the first doctors in the DMV area that provides home care, and as you can imagine, there's a growing need for home care. So we're happy about that. We're working hard, and we do a lot of education. We do a lot of prevention, and we feel happy about being there to help keep people healthy. And I met Dr. Bryson. How long has it been now?
Wow, you're gonna date us a little bit.
Yeah, it's been a while.
Yeah.
It's been a while.
Yes,
But it's been a good relationship.
Yes, and I've been providing home care services also, and I think that's one of the things, connections that we had. We share that vision that where there's a need, we have to stand in the void and take care of it.
Right. Yeah, I know we got a break coming up, so we'll continue to have this conversation as we go to break. But we're going to get into, in the next segment, talking about some of those specific health issues which are affecting our communities. And we're not just here to talk about our community. We're talking about everybody, but with a focus on our community when it makes a lot of sense. And I'm going to be sharing with the audience also. I've been doing quite a bit of writing lately, and ebooks and other materials, and I find that the things I'm putting together just aren't out there. Like one of my books is geared specifically toward the home care environment. One's about the health and wellness for all people, and one even focuses on being a guide for black men, because let's call it what it is. We have a few unique medical and health issues that are different from everybody else. And as we get into our conversations going forward, we're going to be talking about healthcare disparities too. Because I heard what you said earlier about, I think you said amputations. And we know there's a mismatch. A lot of African Americans suffer complications from diabetes. And we want to know why so we can prevent that.
Yes, if folk will listen, we had info for them.
Yeah, absolutely. So and then we're going to talk about even you and I. You should have your doctor, I should have mine, and we should be going to the doctor like everybody else. I don't know.
Which I do.
Yeah, we have to. I always think about my family history and what that means for me. And you and I are going to talk about how much we exercise, how much we don't exercise. You're still looking pretty good, pretty good shape. We got to eat the right food. All that stuff. So we are no different than everybody else. And no one talks about it, but there's a huge component of stress. What does stress do to our bodies? What do you think about that?
Yeah, as a matter of fact, I was recently reading a book, and it talked about the issue of high blood pressure, not necessarily, and it was not just centered around the African American community, but it was making a correlation between high blood pressure and high cholesterol. And it talked about the Italian community, which obviously we know from their diet, it tends to be heavy carbohydrates, and a lot of Italians tend to be heavier people. But one of the things that the book was mentioning is that in certain communities of the Italian American community, I guess I should say, one of the things is that their lifestyle in terms of the family gatherings, eating together, even though they're big people, there was not a great increased incidence of mortality from heart disease and that type of thing. But the book was highlighting the fact that the stress levels in this particular community that they evaluated tended to be lower, because they use this example where the guys would come from work and they would be around the family doing and those things definitely help. So stress is a major problem in our community in terms of what it does contribute to conditions that lead to mortality.
Right, the stress and the socioeconomics. And I'm glad you brought up the issue of diet, because that's a huge issue when you talk about prevention. And one of the things we'll be doing too is bringing in that nutritionist and that dietitian person to help us understand how we should be eating, because sometimes, let's be honest, we just need to relearn some of the bad habits we may or may not have. Without, you can't lose weight without eating correctly. I don't care who you are. And that becomes more and more difficult as you get older. And I think we can all speak from personal experience as well. And as you were saying too, we're going to talk about the, some of the Greek diets. There are a lot of different diets out there that we know are very healthy and helpful in preventing health issues. So we're going to be talking about those issues.
All right.
You know, and it's funny too because I do a lot of talking in the office, and that's the beauty about being on this show. I can almost feel like I'm in the office right now. Yeah, I talk a lot about bacon. You know, I don't know about you. You like bacon?
No, I must admit, I'm not a big bacon guy. I would do some turkey bacon, but not the pork bacon.
Yeah.
Unless, you know, sometimes my wife will fry it up and.
Right. And that's cool too. But the reality is, we just have to understand if we do like it, the good, the bad, and the ugly too. And the reality is, bacon is one of the worst things out there for you. But we all do it. We all do it. And you know, there's more of a focus now on eating a green diet, more salads, more broccoli, more Brussels sprouts, which, by the way, are some of my favorite vegetables too. And I always tell people, when I grew up, it was all about pork chops. And I don't know if you remember it, but maybe you too. You know, my mom would fry up the pork chop, and when it was all done, you'd have all that flour, that fried flour in the bottom of the pot. You throw some water in there, and that was your gravy.
Gravy, yes.
And the reality is, we all, I think, did it, but we should know now it's probably not the best thing for you.
No, it was not. But boy, my mother, you know, I grew up in, to a large extent, in North Carolina, Winston-Salem specifically. Yep.
Right.
So even though, and my mother would do something called fatback.
Oh my goodness!
Now I haven't had it in years, but we would take that, and hey, that was better than dessert for us.
Right.
But those days have passed, I must admit.
Well, that's the beauty too, because you get to reflect on those days, and I think it's kind of good when you can go back in time and see what it was and see where you are. Like for me, I had the great fortune of working in a butcher shop as a kid. So I don't know, and I tell people this, I don't know if you've ever seen ground beef produced before. And I'll tell you, man, just imagine a huge dumpster and you're just throwing anything into it, fat, bone, whatever. And there's a big grinder in there, and that's your ground beef, man. So the reality is, you know, we're going to be talking about these things. We're going to be educating. You know, we're going to be talking about the chronic health issues, and hopefully we're going to be making a difference.
Yes, we will.
Yeah. So when it comes to what you're doing on a day-to-day basis, tell me, what do you like about what you do, and what are you hoping gets better?
Well, one of the things that's always gratifying is that, as I said before, with the nature of seeing seniors, you see a lot of folk who are in need of care, and the care is one of the lack of care is one of the things that directly correlates to their quality of life. As seniors age, obviously less mobility, but simply because you're not walking as much does not mean you're still not in need of foot care. That's one part of the spectrum. But the other part of the spectrum, because I also have, over the course of my career, dealt with a lot of athletes and folk that are active. A lot of females will come in for various reasons. Part of it is just from a cosmetic standpoint. They may have developed the things on their feet, the corns, the calluses, that type of thing, which often are a result of shoe gear. But what that does is limit their ability to probably participate in other activities. I hear people all the time who are saying, well, I need to go to the gym, but my feet are hurting, so it's very uncomfortable, so I don't go. So one of the things I've been able to do is have some direct intervention in terms of addressing whatever foot ailment they may be having, so that they are able to, so that's not a limiting factor in terms of them not going to the gym, because it's sometimes, you know how it is, you'll get busy, and we don't need impediments to do things that will help us in the long term.
Right. And I feel like since we're real comfortable having this conversation, I'm kind of cool not even having the break right now, by the way. You know, and you know, it's kind of cool. You know, I'm really looking forward to right now hearing from you on two particular topics in foot care. Number one, can you comment on plantar fasciitis?
Yes.
Very common issue, right?
Yeah, very common, very common. As a matter of fact, I had a patient this morning with it. And typically what happens is that on the bottom of our feet, there is a tendon, and that attaches to basically our heel bone, and it proceeds towards our toes, and then it spreads out. And that tendon becomes inflamed over a period of time.
Right.
And that inflammation is what it contributes to the pain. And if it persists, it can actually lead to a heel spur.
Okay.
And that's actually on the bottom of the foot, but actually at the back of our heel, we have a condition because there's another tendon that attaches there from our lower leg, and there's a condition called Haglund's deformity. And I mention that because here in the DMV area, we've been recently shared the news about our star point guard is out.
Yeah.
And part of his initial diagnosis was the condition was Haglund's deformity, which again is a condition that affects the back of your heel.
Right.
And it had developed some arthritis, inflammation, and he was having surgery.
Wow.
And ultimately, he experienced an accident, and it caused him to actually rupture his Achilles.
Right.
So getting back to the initial diagnosis of plantar fasciitis, usually it can be debilitating if not treated. Luckily, there are a number of interventions that could be implemented that will minimize that.
Good. Yeah, that is just, if I'm correct, that's one of the most common causes of heel pain in anybody.
Yes, yes.
And by the way, those Achilles ruptures, they scare me, man, because they can happen at any time. And that's one of the reasons why I gave up basketball, too, because I just felt like it was just a matter of time before it was going to snap on me.
Yes, as we age, we lose basically the lubrication for that area.
Lubrication.
Yes. So our tendons aren't as flexible as they were at an earlier age, and any type of additional stress, it doesn't have to be a lot, but twisting or stress, and it can tear or partially rupture. And again, it's becoming one of the more debilitating conditions, especially specifically on the professional level. You know, we can just mention John Wall condition with his heel, but what they're sharing with us now is that because of the condition of his Achilles, the rupturing of his Achilles, he may be out for a year, whereas previously when you had a knee problem, then that may be a 6 to 9 month rehab period. Because at one time, knees were definitely conditions that would in your career. There's been improvement with knees. However, with the Achilles situation, you're still talking now, it's longer to rehab an Achilles than it is a knee.
Wow.
Yes.
Yeah, I mean, I'm kind of wondering, will he ever be the same, you think, John Wall?
Well, none of us will ever be the same.
I mean, following that injury.
Yeah.
It's professional athlete. Knowing speed's a huge part of his game, too.
Very much so. And that was one of the discussions I heard on another radio station today. So it doesn't look good for the Wizards. So we've transitioned from that condition. But again, Achilles are tough problems. And that's just one of a myriad of foot problems that not only affect athletes but everyday
now I'm
individuals.
I'm going to share with you another foot issue, and I use this a lot in my office now because we're going to be talking more about the details of diabetes. But I had this one patient, and he was a long-term diabetic, and he had been pretty stable. I hadn't seen him for a while, but it turns out somewhere along the way he decided to pick a sore on his foot, and when he did that, it turns out it never healed, and he wound up having to get that toe amputated. And so what I tell people now, and I've always told them this, but I remind them very clearly, never pick sores on your foot, especially when you're diabetic. What are your thoughts on that?
That's great advice. One of the things from the etiology of diabetes, what to a large extent happens is that your nerves that control your blood vessels to help healing are their efficiency is decreased because of high, what we call either blood sugar or the glycogen in your system. And once you develop a situation where there's a inhibition of your ability to heal, than when you develop a sore or something as simple as a callus, and you injure it further by either using some type of blade or whatever you may use to try to pick it out, then you're seeding the bacteria in your foot. And what tends to happen is that the immune system is not able to overcome the fact that you probably already have some circulatory problems.
Right. Didn't know
At one time, diabetes was referred to as a small vessel disease. And so therefore, the small vessels, where small vessels are predominant, is where you would see a lot of diabetic problems, even from eye conditions and obviously in your foot, because there are a lot of small vessels there.
Right.
So again, it's really related to the inability of your body to heal.
Right. Yeah, I agree with you on that one. You got to take care of those feet when you have diabetes. Very, very important. So, one thing I didn't get a chance to do is to give a little bit more background on me and, why I became a doctor. It turns out, I don't know how it happened, but somewhere around the age of 10, I knew I wanted to be a doctor. I remember a friend of myself, we used to catch birds when we were small, and some birds we'd even find with broken legs, and we would try to nurse these birds back to health. And I don't know if it was also the $6 Million Man, by the way. We're about the same age. You remember that show?
Yes.
I think it was Dr. Marcus Welby on the show. There was something about Dr. Marcus Welby that kind of just said, I want to be that guy. And somewhere around the age of 10 also, my mom used to smoke. And I remember somehow getting enough money and giving her a book to stop smoking. And so I always had an interest in health from a very early age. And luckily, somewhere in high school too, I looked at how long it would take to be in school, man. I started thinking, I don't know about this, because, all the schooling, 4 years of college, 4 years of med school, and then another 3 years of residency. So you're well into your 20s when this is, when you're trying to do something like this. And it just so happens, my mom, she had very bad blood pressure, like a lot of people in the community. And it was so bad that she focused on her 6 children, single mom. And eventually, all the things that can go wrong with blood pressure pretty much happened with her. We're talking about heart failure. We're talking about kidneys shut down on her. And when she was alive, she was one of the longest dialysis patients in that particular area. And I'm telling you, so I've always had a concern for trying to take care of blood pressure. And, I think a lot about her when I see my patients when it comes to blood pressure, because nowadays it's not uncommon. Normal blood pressure is 120/80, but it's not uncommon to see a blood pressure of 200/130 in the office, man. So it's crazy. But that's what got me into it.
Yeah, well, it was good that you were able to experience. Unfortunate that some of the reasons why we choose to do things, and part of I can relate again, as I said, with myself, it was having specific foot problems and being exposed to podiatry that ultimately led me into it. And I think in general, in any healthcare endeavor, there has to be a certain sense of wanting to help people, a certain caring that and empathy that you have for your patients or for people that will lead you to want to do it. And one of the things that I remember, Marcus Welby and those kind of things. And, even in our community, I must say, I was exposed to a lot of medical practitioners. And as a matter of fact, there was actually a black hospital in my hometown of Winston-Salem.
A black
hospital?
Hospital?
A black hospital, yeah.
So like Harlem Hospital?
Yeah, well, KDB was Kate Benning Memorial Hospital. KDB, I remember that. And a number of, we actually, first few years of my childhood up to elementary school, we actually lived literally right up the street from the hospital.
Wow.
So I would see, black professionals, hear about them, and cross paths with them at church and that type of thing. So it wasn't foreign to me to know of black, and I had an aunt who was a nurse. So I was exposed to the healthcare, some healthcare professionals.
Right.
And so it was one of those things where when it came time to make a decision in terms of what do you want to do with your life, one of the things that motivated me was a need to want to help people and then do something I had some personal previous involvement with. So that's...
So again, the call-in number, if there are calls, is 240-719-2560. And it's funny you mentioned that, too, because the reality is, in some cases, that's all you really had when it came to your health care, those hospitals in your community. And let's appreciate the rich history of Howard University and Howard Hospital, Meharry, and those kind of places. So those are huge institutions when it comes to producing doctors and supplying the physicians and other healthcare providers for our communities.
Yes, and that's, you mentioned earlier health disparities. And I guess that's one of, in my opinion, one of the reasons that we do have health disparities, because I think without a doubt, you can relate, if there's a need to be able to relate to people who are giving you information.
Right.
Now, one of the things in our community, I've seen a number of studies that have indicated that African Americans tend to do better when they have an African American practitioner. Yeah. Well, I know the landscape has changed due to insurances, due to big pharma, due to, and especially in this community, how the MedStars and other entities are taking over health care delivery. And so we have to be very cognizant of the things that help us and those that tend not to be as much of a benefit as it may be purported to be. So there's no substitute for doing your own homework, having information, and knowing which tests to at least be aware of that may be needed to help you maintain your health or find out what problems may be pending.
Right. And you're exactly right. Relationships have a lot to do with you being comfortable and knowing who that practitioner is, and the data is out there. And what surprises me, I just finished reviewing the numbers. If I'm correct, the number of African American physicians, a very small percentage. And somewhere around 1990, the number of black men, for example, going into medical school dropped. And black women are doing pretty good, by the way, when it comes to entering medical school and graduating. It's the males right now who are suffering quite a bit. So we're going to see a sharp decrease in the number of male doctors in the next 20 to 30 years, where it used to be most of the older, at least African American doctors, it turns out, are older men. But right now there's a shift taking place, and there are more women than men in those positions.
And that will continue when you look at the number of females in undergrad.
Right.
So that just leads to you have to do undergrad before you can do medical.
And that's why I'm glad we're here, because we're able to talk about these issues, and no one even talks too much about what we're talking about. And for example, too, many would be surprised to find out that even the prison system, with black men going back and forth to prison, that has a role in our numbers in these disciplines as well. Not to mention whether you have insurance, not to mention different health consequences of being in that prison system. So there are a lot of complex socioeconomics involved, and it's funny how that relates directly to someone's health status as well.
Yes. Again, when you mention the prison population, obviously we've heard so many. First of all, the numbers have increased.
Right.
Hopefully, individuals who have been incarcerated are also at a higher risk for the sexually transmitted disease, specifically HIV/AIDS, and that has taken very detrimental effect on the health status of our community.
Right, yeah, it's been huge. So why don't we do this? Why don't we just take a quick break? And yeah, you just mentioned it, HIV. We'll be talking about that too. It's funny, no one's talking about that anymore. And that's still a big issue.
I think it was Black HIV Days a couple of days ago.
And it was interesting too, because I even talked to my son about this, and I was surprised to hear some of his comments about it.
I'd be interested to know what he said.
Great stuff, great stuff. We'll see you on the other side.
We here at VoxWave believe that no one in the DMV should go without a coat this winter. So we partnered with Star Imports dealership for this year's annual coat drive. If you have an old or gently used coat that can still be worn, drop it off with us. VoxWave Studios at 4711 Off Place, Suitland, Maryland, and give the gift of warmth to somebody in need in the DMV.
Promote your products and services, VoxWave is the right place. We have over 10,000 views a day and 70,000 listeners a month. For more information, contact Reg Gaskins at 240-832-4455.
VoxWave now features a streaming radio media player on our website's front page, where local artists can get their music played 24/7. For more information on getting your music in rotation or to perform live at our studio, contact Reg Gaskins at 240-832-4455.
Android users, the VoxWave app is now available in the Google Play Store. Download the app today on your Android device to listen in and view programs.
All right, well, welcome back to Doctors in the House. My name is Dr. Darrell Hill, and I'm with Dr.
Rick Bryson.
Rick Bryson in the house. So thanks again for coming in today.
My pleasure.
Been very exciting having you here. So let's go ahead and just talk real quick. You know, we'll get into more details later on some of these important health issues taking place right now. You know, we talked earlier about diabetes, but we also have heart disease being the #1 cause of death for us all, and those numbers continue to be very high. And you know, then we got cancers to worry about out there, colon cancer, prostate cancer, and those are scary things, man. Those are scary.
That's a lot of bone cancer.
Yeah. So I find a lot of black men, including myself, I'm terrified, even myself as a physician, of prostate cancer, because the numbers are so high as we get older. I'm just going to continue to encourage people to get checked. Got to get checked.
Yes. You know, there's when you talk to patients, one of the things I've seen, especially even as we get more information, the key is making sure that you're able to understand the information you're getting. And I use PSA for example.
Okay.
You know, I've heard various comments and even studies that talked about the viability of doing that test. I've read anywhere from yes, do it, to, well, the numbers, don't rely on it.
Okay.
So people will share with me their experience, whereby as I'm seeing more older people, gentlemen are saying, well, the doctor told them don't worry about the PSA. But what's your comments
Well, that's
on that?
a great question, man, and I'm glad you brought it up, because it's a complicated answer, because the doctor's right. Keep in mind, PSA, which stands for prosthetic specific antigen, is secreted from the prostate. As we get older, that level goes higher. It also goes higher with cancer too. And clearly, the data says as you're getting into your 60s, you need to have a conversation with the doctor, because some say don't even check it unless you've gone over the risk and benefits. For example, if someone is 65 and they have a lot of medical problems going on and maybe won't be surviving for the next 10 or 15 years, some say don't even worry about checking it, because guess what? People get prostate cancer, and this is hard to say, they don't always die from it. They die from other things. And you can imagine you gotta speak and tread very gently on this topic, because I'll be honest with you, I was 1 year at a residency, and I didn't quite understand how to articulate this. And I always share this story because a patient came in, and he came in with his sister, who took care of him because he was mentally challenged. And I said what I just said to her, and you can imagine what she thought. She thought I was saying it wasn't important to do it in this particular individual. So you got to be careful how you talk about those words. But yeah, there's a lot of controversy, and there was a big article in the Washington Post just last year about this topic. So what it really comes down to is that doctor-patient relationship, and making sure the patient understands the risk and benefit. Because what's happening is, remember, when that PSA goes high and you want to know what's going on, you got to get a biopsy. And those biopsies are pretty invasive and pretty painful, so you want to get it in the right people. And then you want to be able to affect outcomes. So if you're going to treat somebody for something that isn't going to hurt them, why are you going to even go through all of that? And that's part of the whole dialogue that goes on.
Yes, and I can even relate a number of patients that I've crossed paths with would share with me that even though the PSA numbers may be going up, but that is not a one-to-one correlation to say that you have prostate cancer,
Right.
because infections can cause something.
Prostatitis.
So what do you tend to advise your patients or related
Well,
to?
these are great questions, because I just went through this last week. And it's usually on a case by case, but I always have a conversation with everybody. For that guy who's clearly young, less than 50, get the test. Even for older people, if you get the test and it's normal, there's no controversy. So a lot of times I say get the test and we can have the conversation later. But if there's somebody who's very sick and understands the conversation, I'll purely just lay out the pros and cons of both scenarios and kind of let them make the decision. But clearly, that older person who's demented, who's bedbound, whose quality of life is already pretty poor, we don't worry too much about it.
Well, another question I have. Now, in terms of some of the over-the-counter, I guess technically anything that you put into your body could be considered a drug. So with the number of over-the-counter supplements that are available, do you tend to recommend males take any of those?
It depends. For some of them I do, only when I think the benefit to the patient is going to be worth any potential risk. You know, I still advocate things like fish oil, maybe things that can help your joints. But I remind people too, in healthcare, we like to have data behind any recommendation, and sometimes the data just isn't there, so you have to make a decision on smaller type studies that suggest a good benefit without having those larger studies which are more convincing.
Yes, and I find myself telling people, I think it's a mistake to say, well, I'm going to take something for high blood pressure, but don't change lifestyle. I'm going to take something to lower my cholesterol, but I'm not going to alter the way I eat.
And that's a different level of question for me, but you're right. Lifestyle has got to be there for everything, exercise and diet. But I tell my patients the same thing. When you start talking about taking a garlic pill for your blood pressure, that's a different ball game. If I do something like that, you know, there's no science behind it, so you'll never hear me encourage someone to take garlic pills or things which aren't proven to be a benefit, because that's a time bomb waiting to happen, and I want no part to that one. So I know we're kind of coming up towards the end of the show, so what I do want to do is take a moment. We have a segment here where we talk about things in the news which are health related and might be of some educational relevance. So let's talk briefly about what's happening in Virginia with the governor. You know, in case you don't know, the governor for Virginia, in his yearbook back in the 1980s, I think it was, he was found to be wearing blackface, and there was a KKK costume involved. We don't know if it's him or if it's not him, but we do know it was his medical school, and this happened. What do you think about that?
Well, obviously, in this total climate with the Trumpism, it's so amazing that once the picture surfaced, from what I can gather, the governor's first comments were he was going to apologize.
Right.
And then within probably hours after, I'm sure there was some consultation somewhere, the story has changed to it wasn't him. But and we were all calling for the governor's resignation, and then we found out that there was a situation with his lieutenant governor, and then we found out that there was a situation with who was third in line? Was that the Attorney General? Yeah, with this blackface issue, and I'm thinking about it. My thoughts are, one, first of all, when they were accused of being a racist, I've always had this comment to people: to be a racist, that's actually just a noun, but to be racist, you know, that's a verb. So that should mean that you have done, there should be some body of work that you could relate to, because if you're a rapist, then someone has been raped.
Right.
So if you are a Buddhist or anything that has any religious context to it, you practice that particular religion. But to be called a racist, I would think that there should be something to confirm some act or actions that would confirm that you are such.
Yeah, I was amazed by what we saw out there, because my immediate concern was, what does this mean, number one, that the medical school published it, number two, that no one said anything about it. You know, we're talking about now over 20 plus years of this being out there, and no one said anything about it. And then what does that mean? Does that translate into how these doctors in this medical school and this culture treat their people who don't look like them? Those are my concerns.
Yes, and I think the latter is definitely the case. Back in the 80s, when this picture allegedly was taken, I guess blackface in our culture, that's nothing that we did. And I guess from a comedic standpoint, I'm almost certain they thought they were being funny. They were being funny. But it's certain things that now we take more sensitive now. And I guess, for lack of a better phrase, then the governor himself, even though I'm not a Virginia resident, I think he probably, I would not go so far as to say he's a racist.
Right.
But he did something that, in hindsight, I'm sure he regrets. But that just shows you, at some point, it was accepted. It was accepted. They felt comfortable doing it. And the implications of how others would, specifically African Americans, would perceive it, I'm sure it didn't even cross their mind. They didn't care.
Wow. Yeah, I'll tell you, man. So why don't you go ahead and share with the audience again your contact information?
Yes, you can reach me 301-706-6437.
And myself, I can be reached at 301-497-0401, and also at laurelmedicine.com, LAUREL medicine.com. So as we continue along with the show, let's talk really briefly about what are some of the things you do to promote health for yourself? What are some of your personal things that you think works for you?
Well, one of the major things, and I must say I was very fortunate to come from a family where health is important.
Mm-hmm.
Part of it, I have some relatives who are Seventh-day Adventists, and their religion, obviously, more so than most religions, emphasize eating practices which tend to be of a health benefit. And so my thing is obviously to practice what we do know are practices that don't contribute as much as others to detrimental health, such as eating right. I was an athlete growing up, and I've tried to maintain some athletic endeavors to help with heart health.
You get into the gym? What do you get into the gym?
Well, yes, but I also have some cardiovascular equipment at home.
Good.
Don't use it as much as I probably should, but the other component you said before was diet. We very, luckily, my wife is very cognizant of eating healthy and minimizing those things that tend to contribute to ill health. We minimize our red meat intake, for instance.
Right. So we'll have a chance to talk more about lifestyles, diet, exercising, some of the simple things that can make a difference, kind of like what you just said, cutting down on the red meat, getting more of the fruits and vegetables in. And one of the things we didn't talk too much about today, we'll be getting into dementia too. I don't know how much dementia you see in your practice.
Whole lot.
But I was surprised to find out that apparently African American women have incredible numbers, along with just African Americans in general. I did not know that until recently. And my research is showing me there's going to be an explosion between now and 2050, by the way. And when I did the math, that kind of put me in that group in my 60s and 70s, assuming I'm still here. But we got to do everything we can now to get smart about that, and hopefully the research will make a difference.
Yes, people are living longer. Now, the question then becomes, is the quality of life the same? But I would argue that typically the quality of life has not maintained, simply because with lack of mobility, so many people that I deal with are homebound, have been stricken with cancer, but they're not dead, they're still living. However, there is a question of the quality of life.
Right. And it's interesting too, we're going to talk about that homebound population, because to me, that is a untreated and almost left behind segment of our health population. You know, I'm thinking right now about that patient I saw last week who literally lays in the hospital bed in his living room at home. You know, he's been amputated, both legs, and cared for by the family, and what that means for the caregiver. The caregivers, they're the ones who really are under so much stress and need support in the home to continue providing that service. So there's a lot going on out there.
Yes, it's much needed, brother. So we'll stay tuned.
Yes, sir. So, you know, we're getting to the end of today's inaugural segment, and I'm telling you, man, I've had a wonderful time being here with you. I've had a great time getting into some of the issues we're going to be talking and getting into deeper. Just want to remind our viewers, we're going to be bringing in different doctors, talking about a variety of different issues. And at the end of the day, it's all about improving health and helping people live longer and maintain quality of life.
All right, everyone, stay tuned.
Yes, sir.
All right.